Flying with varicose veins, tips for safe travel. My name is Sriram Rajagopalan. I am a vascular surgeon who practices variety of vascular procedures, including varicose vein treatment. If people have stagnation of blood in the legs due to their varicose veins, and you're pretty much seated in the long haul flight for a period of time, people do get out of the flight to find that their ankles are a bit more swollen. That's purely because the venous blood from the leg hasn't returned back in the same way that it does when you're actively moving around. So that's why they feel the symptoms or heaviness of the legs after a long haul flight. There are flight socks available, which are available from local pharmacies or online. Those can be worn to reduce the discomfort that you may have at the end of the flight. And in the flight journey itself, strongly encourage people to walk up and down a few times, drink plenty of fluids. Although there is no big evidence to it, if it's a really long journey, there's no harm in taking a small dose of aspirin tablet from the day before, on the day of travel, and possibly the day after. It's just an extra medication to keep the risk less, and they're subjected again to not being allergic to aspirin, and they're not already on any other blood thinning tablets. So it's an extra adjuvant, but not a mandate. But wearing flight socks or compression stockings and walking in the flight and drinking plenty, I think those are the cornerstone for reducing the discomfort. Significantly disproportionate leg swelling that appears either in the calf or the entire leg is a warning sign that they could have had a deep vein thrombosis. A minimal puffiness in the ankle on both legs is not a bad thing. It can be just a result of the legs having stagnation of blood. But if any one leg is out of proportion to the other one, and it's a tight swelling of the leg that you can't wear your normal clothing, and you feel ache, discomfort, those are signs that the leg could have suffered a deep vein thrombosis. And that should not be left alone. It is asking for an urgent appointment with the hospital to rule out a deep vein thrombosis. And if it is the case, the treatment has to be started immediately. Having varicose vein does not predispose somebody to an extra risk of deep vein thrombosis. So I would reassure them that they're not an added risk for clots in the veins. They may have extra discomfort after the end of the flight because of the stagnation of blood and the person being less mobile in the flight. As long as they have the standard precautions taken, which can be for those with varicose veins and those without varicose veins, it would reduce the chance of DVT. VeinCentre functions pretty much for patients who have either cosmetic or symptomatic varicose veins, or both. The consultations are very transparent, where the assessment is done on the same day. The risks and benefits of the procedures are explained very much, not just verbally, but by also supplementing it with a patient information pack. Patients are not forced to make any decisions immediately. They can think over it and then get back to us.